Welcome to Tea Time with Dr. T, a video series designed to make conversations about mental health and addiction more approachable, practical, and human. Hosted by Dr. Tammy Malloy, CEO of Futures Recovery Healthcare in Tequesta, Florida, an experienced clinician and behavioral health leader. This series offers grounded insight into the real questions people are navigating today, both personally and professionally. In each episode, Dr. T shares thoughtful perspectives on current trends and day-to-day challenges in mental health and addiction. So grab a cup of your favorite tea or coffee, take a breath, and join Dr. T for bite-sized conversations designed to inform, encourage, and help you feel more confident as you navigate your wellness journey.
Good afternoon and welcome to Tea Time with Dr. T. I'm Dr. Tammy Malloy, and today we are going to be furthering the discussion on post-traumatic stress disorder with co-occurring disorders. What I'd first like to say is there are those that have been experiencing PTSD symptoms that use substances to cope with those symptoms. And sometimes they're newly using these substances, and sometimes they've been using them for quite some time. So before any work can be done, that has to be addressed, meaning that if somebody is addicted to a substance, whether that's alcohol, opiates, a benzodiazepine, that has to be addressed first, and they need some time in recovery before diving into those traumas or single trauma event. What we talked about previously is that PTSD is a event that occurs that is traumatic to that individual. And again, not everybody that experiences a traumatic event develops PTSD symptoms. And then there was also complex PTSD, which sometimes can originate in childhood, but it definitely entails more than one trauma over a period of time. Now, PTSD does go hand in hand with things like depression and anxiety. Usually, somebody is experiencing those things, the hopelessness, the lack of sleep or sleeping too much, even suicidal thoughts or suicidal ideation, may have even had suicide attempts in the past. Generally, if it's gotten to a point that it's been untreated for a long time, it's gone undiagnosed, and finally you're getting that help, the symptoms could be more severe. Whether you're using substances, you've isolated, you've cut out your support systems. For PTSD to be diagnosed, you need to be experiencing these symptoms that we talked about in the previous segment for at least 1 month. And generally, those symptoms are going to occur within 3 months of the event. Now, if it's complex PTSD, those symptoms have been reoccurring in your life, and you might have been doing the emotional numbing, which is a symptom of PTSD, to avoid working on those traumas. Now, I think that any type of assessment that you do is going to be important. And I know a lot of people don't like to do them, but it's really important for you to have an understanding along with the professional that is assisting you to have an understanding of where you are at with these symptoms, because they are on a continuum and some are more severe than others. And in order for you to walk that path side by side with that professional, you both need to know what to expect from that. Thank you for joining me today for Tea Time with Dr. T. And remember, it's important, whether you drink tea or not, to take time for yourself each and every day.